Defensive documentation, learning the right way to write. What is defensive documentation? The term defensive documentation refers to a thoroughly accurate accounting of all the circumstances surrounding a resident issue. It's documentation that you take with the sensitivity that you know that people on the outside may be reviewing these records looking for fault at a later date. Why does it matter? One of the most helpful ways a staff member or a facility can defend itself can be found in the accuracy and thoroughness of its documentation. This is just as true in a state survey situation as it is in a courtroom or legal proceeding. One of the most important reasons to document defensively is to realize all documentation has an audience. Although you may be writing just for your notes, there could be a whole host of people looking at your notes at some point in the future, whether it be clients, family, coworkers, lawyers, a coroner, police, surveyors, auditors. You need to write like you're going to be questioned. When you document defensively, clear communication is a key point to remember. A facility can have very competent staff who give excellent care, but if their documentation does not give that impression, that's usually the reason they're being questioned in the first place. You must remember all documentation is a legal record of care delivered. You can be questioned about incidents or complaints. It is your reference and your defense. In a world of high expectation, we're questioned even when everything possible has been done, and it could be sometimes months or years after an event. How will you remember if it's not written down and in a very clear and concise manner? Some cases where documentation is so important would be like care delivery for the residents. Any complaints or incident investigations, coroner's investigations, legal cases that come up, and complaints commissions all can investigate and read your documentation. Incidents and complaints, they happen, even with the best care and to the best staff. And generally, it could be anything from falls and choking and pressure injuries, infection, medication errors, neglect, and especially behavior incidents, any kind of aggression, abuse, or assault. These are all types of incidences that need to have clear, concise documentation. A few examples: complaints may be of neglect, like ongoing weight loss or poor mouth care. These all raise questions that will need to be investigated. You need to be prepared by documenting with clear, concise information that answers the questions. Anytime you're ready to make a note in a residence chart, think about what you want to say before you say it. Have a purpose for your entry. Be descriptive, concise, and precise. Don't leave problems from a previous shift unaddressed. Any issues that might have recently happened or changes in a resident's condition, they have to be clearly and accurately described. We'll go over a couple of the most common documentation errors next. A common documentation error is number one, illegible writing, although the use of electronic record has improved that, but you still need to be able to write clearly and legibly for any paper forms that are completed. Very commonly, irrelevant information like had a usual day or had a good day, slept well, very subjective and do not accurately describe the resident's response. Same with the subjective documentation, like labeling someone demanding or aggressive, such as a difficult resident or problem behaviors or combative. These are all your interpretation of what it felt like. You need to actually describe the behaviors that you witnessed instead. So it's important to not just say had a good day, but why was it a good day? Did she Eat 50% of her food? Was she interacting with the other residents? Was she singing along with the sing-along sessions? Those type of things. Be specific about what you see. Actual behaviors. Don't use combative. What was seen, such as striking out at caregiver or other resident, screaming in anger, or pounding fist on door. Yes, that's combative, but that's much more specific to describe what was happening. Probably the biggest documentation error that many do is incomplete documentation. You may have identified a risk or a situation, but you did not mention what action was taken or what follow-up was done with the outcome. You don't leave the reader in suspense wondering what happened. Describe how the resident responded and the reactions to any therapy, any medication changes, or PRN medications that was required to be given for a certain behavior that you have already documented. Avoid vague terms like will monitor, continue to observe, or follow up. Describe instead what you did. I checked on the resident every 10 minutes. She has now settled down and is happily playing a game with another resident. Things like that. Be actually specific. What made you write that you're going to monitor them? A few examples of incomplete documentation would be things like writing difficulty swallowing, but not what was done about it. Did you notify someone or give them softer foods? You documented pain relief given, but not why or how you knew it worked. Describe the behaviors. Did they fall asleep within 10 minutes? Did they appear more calm and start interacting with other residents? If you write refused care or refused medication, you need to add the steps that were taken to correct this. Did you reattempt in 30 minutes with success? Documenting didn't eat much for a meal. You should always document exactly what percentage of each meal was taken. Was it 50%, 75%? Use your best judgment. It's important because then you can monitor the trends and always document the residents' meal intake in the EMR so that we can watch for any kind of trends. Be detailed about your writing. Don't add their descriptives such as good, bad, some, or all, but give the specific actions that you saw and then what you did to help, correct, or prevent further occurrences. You should always ensure that your documents, your notes entered into the medical record correspond with the resident's care plan as much as possible, and update that care plan as often as needed. Never, ever reference an incident report in a resident's medical record. This will limit the discoverability by an attorney and retain the privileged internal status. Incident reports are for your safety and the facility's safety, and if it is mentioned in the documentation notes as being completed, then they can use them against you or the facility in a legal proceeding. Always complete one when one is needed, but do not mention that one was completed in the care notes in the resident's record. And along with this, make sure you document in a very timely manner all family and physician notifications for any incidents, any change in condition, any alteration in treatments or continued refusals, room changes, anything that has to do with the resident that could be of concern, and document it in a clear, objective, and concise note. A key point to remember is that documentation with any contact you have with family or healthcare provider is important. This will enable you to defend yourself long down the road when you know you did it. But if it was not documented that you contacted them, then it will be considered as not done. And I will stress it again, that's what this slide is about. If the resident is refusing medication, hygiene, food, or other care on a regular basis, inform the resident's doctor or healthcare provider and document the details as to exactly what is being refused in the resident's nurse's notes, including any measures you took to try to remedy the situation. Always You should always document in the care record any time the doctor or other healthcare provider was notified of any situation or concern. It is for your own defense that you record all communication with family, doctors, and healthcare providers. It may be years later you have to defend yourself against the word of someone else. So, in summary, 3 reasons you need to document defensively. You need to defend or even prevent litigation and complaints against you. You need to support your memory if you are questioned about events or incidents long down the road. It could be weeks, months, or even years later. And now you will be under the stress of recall. The more you write, the better you will be able to recall and defend yourself. And to provide written evidence of your skills and competence. It shows that you are delivering good care by documenting the follow-up and contacts that you are doing. Defensible documentation ultimately makes your job easier and more enjoyable when you don't have to fear criticism at any time in the future. And your future self will definitely thank you for taking the time today to document accurately and completely. Thank you for your attention. Always remember, good documentation is your best defense.